nurses are already leaving the profession in such fast, terrifying numbers. 100,000 left last year. They expect 600,000 more in the next 3 years to leave the profession. We already had a shortage before any of this happened.
Yeah. Welcome to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm your host, Logan Plaster, with my guest today, Ryan Lee, CEO and co-founder at HireMe Healthcare. Ryan, great to see you.
It's great to be here. Thanks for having me back, Logan.
So Ryan, you are upgrading the experience of hiring nurses right now, okay? Talk to me about why that is a core issue in healthcare versus maybe just like a tweak to a side of the system.
I would argue that the whole issue facing our nurse population right now is the biggest issue in healthcare. It's the very foundation and the very backbone of it. And it's multifaceted, of course. It's not just if we fix recruiting, then healthcare soars into, rises like a phoenix out of the ashes. But, by addressing this problem, we're targeting the pipeline here. And when nurses are already leaving the profession in such fast, terrifying numbers. 100,000 left last year. They expect 600,000 more in the next 3 years to leave the profession. We already had a shortage before any of this happened.
Yeah.
And some of these nurses are looking for what might be their one last time, saying, I'm going to try this one last time.
Wow.
I'm going to give it one more go. And if that's not the right fit for them, then there's another nurse gone, and it's going to be really hard to convince someone to come back.
In your experience, why are nurses leaving the profession?
It's a number of things. I think the easiest way to summarize it is just underappreciation. And
Really?
that shows in a lot of different ways. It shows, a lot of people think pay. That's the biggest issue. And nurses are these greedy people that just want to be paid more. But that's barely even in the top 5. It's the number 4 reason that the nurses leave the profession or
Really?
leaving permanent roles for travel. It comes down to on-the-job stress. It comes down to lack of opportunity for professional and personal development. And then it comes down to just, the burnout and overworking component and lack of support from their organizations. And all of this comes under that funnel of being underappreciated and not being recognized and treated accordingly for the absolutely critical value that nurses bring.
So all that makes sense. It all seems like those all seem like problems that need to be solved at the hospital level, but you're coming at it from a recruitment level. So kind of connect the dots for me.
Yeah, so we're here to attempt to eliminate friction in the process, and there's 2 parties to this relationship of employment. It's a different look when it's nurses, it's caregivers, it's bedside, it's lives at stake, but it still is an employment relationship, and so. What we're trying to do is to address this problem right from the very get-go by finding the right people, matching them based on criteria, both personal and professional, to the right fit. And from that, you're giving them a real opportunity to start in a better position. And I agree, there's a lot that needs to be done at the hospital level. And some health systems out there and some of the smaller hospitals especially are really trying to take initiatives and saying, recognizing the severity of the problem and their role in it. But it's still a relationship, and by addressing both sides and almost trying to mediate the process and make it more fluid, we can really facilitate a better opportunity for that to work out.
Okay. You mentioned personal plus professional. Obviously, there's lots of nurse recruitment going on today. I think a lot of it is, more on that professional side. So talk to me about some of the elements you've added to the process to kind of, I don't know if it's your secret sauce, but kind of make it a better experience.
So what we're working on right now is giving this opportunity to really talk about, let's say that pathway of professional and personal development, bringing that into the application process instead of, are you technically capable of this job? Because a lot of people would check that box.
Yeah.
But that's different than being a right fit for X floor and Y hospital and Z system. And so what we're adding to the process is an opportunity to really get into the weeds about who are the people behind the paperwork here. And let's talk about what your goals are. Where this might be a job where we need someone to stay in an ER role for a decade.
It's not a growth role.
Right.
And it could be a great job, but not a growth role.
Exactly. And some people want that. You meet a lot of nurses who have stayed in one place for decades and they love it because it's their deepest passion. So you see it a lot in L&D. But
it's all about expectations.
Exactly.
Is that what you got in for?
And if you harness those expectations and put them in the right in the right part of the conversation from the get-go, you understand what pages you're on and how we can work together to make this the right job, or if it's not, you want to grow and this is not a growth role, let's find someone else who's more suited to this, and let's find you a growth opportunity in somewhere else.
Here's a question. Part of the reason why nurses leave is because they're not being given maybe ways to grow. You asking that question, that's great, but that doesn't solve the problem that the hospitals maybe aren't putting enough emphasis or budget into helping people grow. So do you see some of the work you're doing actually pushing upstream? You want to hire this nurse, he or she says, I'll come, but I want to have some professional development. Then the hospital thinks differently about, well, maybe we should budget for some more professional development. Do you see any of that?
Right. The more we grow, the more we can participate in this conversation and really push for these kinds of things. And we can carry the nurse voice that we get from all of our communications with our base into the employer side, and vice versa. It's a two-way street. But I wish I could say we're seeing more tangible, immediate investment into the development. But people, it's all three areas, from the pipeline all the way to the next steps in that growth stage in the career. And you see some better than others looking at that, but that's where we really find our role as we grow, and as the intermediary in this relationship, is trying to make that more understood, and maybe hearing it from us makes it seem a little bit less like a grievance, even though we're still relaying the same message.
Yeah.
But it's not seen as us having the same type of skin in the game. And they're like, maybe this is objectively true.
Yeah. You tell the hospital, hey, 8 out of 10 candidates place this as a high priority. You're not doing this. You're not going to get the best candidates. It's in the numbers.
Exactly.
So talk to me about HireMe Healthcare, kind of where you're at as a business. When did you launch?
We launched as a company in 2021, and then we got our product together end of 22.
Okay, so you're a year or two old, in the market for a year. What are you excited about for the next maybe 12 months in terms of the product rollout or partners?
One of the things we're most excited about right now is a partnership in the works, and I can give the basic level of detail from it. We've talked about raising money to build out all this.
You can just say it, we'll bleep it during the video.
Yeah, exactly. We've been talking about raising money and building all these additional components to focus on the qualitative side. We talked a little bit about that last time I was in here, and what we've actually found is an organization who's done exactly that, and with proven success across different areas of employment. And it's this idea of bringing values, personality, and goals, and as far as in the team side, environment into consideration, quickly measuring certain aspects of this in a way that can put people into more of a personality box and learn a little more about that fit we were talking about. Do I have an opportunity for growth, but also, am I the right fit for this team? This team has a personality. It's an environment that's established itself. Yeah. Right now it's becoming less of these permanent nurses have stayed put so long that this is the vibe here.
Yeah.
But, it's still important, and that's what we're working back towards. So we're working with this partnership to bring just more to the table in a more sophisticated way than building it all from scratch, and really focusing on that qualitative aspect in the hiring process, which is where we say we take the pages from the dating app playbook.
I was just going to say, the more you describe it, the more it sounds like Match.com. As those dating apps mature, you hear in their advertisements that they really care about good connections, because that looks good for them. Like, we actually want people to get together and for it to work. So are you learning a lot from that industry? It's a pretty mature, it's a pretty advanced, growing industry.
Yeah, we've learned how to answer the questions we feel, because you look at an organization like that and you say, okay, so your goal is to match these people forever, but then you lose a customer.
Yeah.
So we've learned how to answer that type of a question, but what we've looked at is just how these have been tailored more and more towards. Some of them are volume-based business. Tinder makes money the more time people spend swiping. There's lawsuits about the addictive nature and the lack of knowledge thereof from that. But the ones you're really seeing a lot of success in the long-term relationships from Hinge and Match.com and some of the others, because they're really focused on these key traits. And it's finding, this is a human process. It's not just who do you find the most attractive, hope they swipe, and hope the pickup line is good. It's at the core of these human beings, what do they bring to the table that's on the same page that would make them align and become a more powerful force by working together?
And I'm sure using data to figure out sort of maybe non-intuitive connections. You're like two people who like disc golf that are actually going to really stick together. Maybe you don't know the things that are going to be the formula.
Exactly. It's not as obvious as it seems right off the bat. It's not, oh, you're both fans of, give a plug to the Carolina Panthers.
Yeah. Or back to the nursing,
But-
like, oh, the compensation's right and this is right, you're going to be a great fit, when really it has to do with continuing education and how, the data would tell you that.
Yeah.
It might be non-intuitive to the hirer.
Or an assertive personality coming with a group where there's already several different assertive personalities on there, and
Yeah.
it might be clashing. There's so much that, looking to what seems obvious on paper, you're talking about the maturity of the dating apps. I think that's really where they're coming in. The more data that comes through, and this is why we're excited to continue to bring in more and more just information and seeing what works and what doesn't in these pairs. And the more we learn from that, the more opportunity we have to find out, like, oh, yeah, like it is the disc golf is your example. It's the things you might not see as clear cut and straightforward.
I love it, Ryan. Well, I appreciate the update. I know we talked a few months ago, and you've already advanced since then. You have this new partnership coming up. I love any startup that's really kind of pulling wisdom from, I don't know, maybe another industry, sort of a non-intuitive source, kind of pulling in from the dating apps, and seeing how you can use that to help nurses have a more fulfilling career, ultimately so that patients can get the care that they need and our healthcare system doesn't fall to pieces.
Exactly. Everyone should have a vested interest in this because it directly impacts patient care. We're all patients.
Yeah, exactly. Ryan, thanks for coming by. Appreciate it.
Thanks, Logan.
We'll get an update next time.
Pleasure as always. Thank you.